On behalf of the Floridians Unite for Healthcare Coalition, I want to thank everyone for being here today for supporting Florida's advanced practice registered nurses and physician assistants. I want to especially thank Representative Kerry Pigman for being here today and for his leadership. We are gathered here today with a growing number of coalition partners to support greater access to care for all Floridians. Today is significant because it's the Florida Nurses Association's Advocacy Day, a day where nurses bravely advocate for their profession throughout the halls of the Capitol. And this year is a significant one. The World Health Organization has designated 2020 as the year of the nurse and the midwife. And it's with that backdrop that we are here today as a coalition because of House Bill 607 and the potential it holds to increase access to care across the state. So why Florida, and why now? Because there are 278 primary care shortage areas across this state. Because there are over 32,000 licensed APRNs in Florida today that are providing safe and quality health care in their areas of expertise that range from primary care services to women's health, psychiatric and mental health services, anesthesia care, and more. It's because we know that states that have removed barriers have more providers in their rural and underserved areas. We also know that APRNs in the VA facilities in this state and across the country already practice without these barriers. Similarly, those APRNs who are serving right now in the United States military practice without barriers. These providers deliver safe and quality health care to veterans and active duty military personnel right now, today, and safely. By enacting House Bill 607, Florida will also unlock healthcare savings estimated between $968 million and $9.5 billion. The cost savings will reduce the cost of healthcare for Floridians. Lawmakers, business leaders, professional and political advocacy organizations in Florida have come together to say that they want the benefits experienced by those states that have removed barriers here in Florida today. We believe Floridians deserve access to safe and quality health care, and we believe that the time for House Bill 607 is now. Thank you. It is now my pleasure to introduce to you the sponsor of House Bill 607, Representative Kerry Pigman.
Thank you, Nicole. Thank you. The Speaker Oliva regrets that he can't be here right now. He had an event come up, but he has asked me to speak his words here. So let me just read from his comments. Hello, and thank you for being here. Over the next 10 years, our nation will fall short of a need of up to 55,000 physicians, exactly at the same time that our population of senior citizens will be at the highest. But significant primary care shortages exist now, especially throughout the Panhandle and Central Florida. Across the state, there are 278 primary care health professional shortage areas. There are 32,877 advanced practice registered nurses active in Florida who are trained to diagnose and treat illness and disease, yet they cannot independently help patients because of a current state law that requires physician supervision. House Bill 607 allows advanced practice registered nurses to work independently within their scope of practice. 30 other states are already doing this. Today, I am here to show my full support for this coalition, a group of advanced practice nurses and forward-thinking businessmen and associations that want to put patients first and improve access to care in Florida. This effort is worthy, it is noble, and it will make all the difference to the people of Florida who need access to high-quality, cost-effective health care. Thank you. Those are the Speaker's words. For me, it's a blessing that an issue that I feel so passionately about is shared by the Speaker. Florida is in the minority when it comes to allowing advanced practice medical professionals the right to care for patients independently and to their fullest extent. As a physician, I've seen incredibly experienced advanced practice registered nurses be supervised by physicians, but this supervision is not direct. It's not what you think. It does not have to be on site. It does not have to be in real time. This supervision can be essentially meaningless. At this very moment, at this podium, speaking to you in Tallahassee, I could be supervising nurse practitioners in Miami, Florida. Often supervising physicians never see the advanced practice registered nurses' patients. They never review a chart. They never do a patient consultation. Yet many physicians charge advanced practice professionals thousands of dollars a month to sign the required supervision paperwork. Last weekend, I spoke with an advanced practice registered nurse who is in the Panhandle of Florida, in a rural community, and she expressed her frustration in trying to find a supervising physician. The ones she spoke with were asking up to 30% of her gross revenue in order to be supervised. You can see how for some physicians, this is a lucrative business model. Many of these physicians are part of the Florida Medical Association, and unsurprisingly, the FMA staunchly opposes APRN independent practice. The FMA and some of their member physicians make false claims, scare tactics, to ward off support for a policy that could help so many Floridians. They provide anecdotal stories of bad behavior, bad outcomes. But here's the truth from a physician, from me. Every study that's ever been completed has shown that advanced practice professionals are safe and highly effective medical professionals. They have the skills, they have the knowledge to effectively care for patients. And not one study has ever shown that they are unsafe. Now, I'm an emergency medicine physician. I know that these people are effective because these APRNs are my day-to-day trusted colleagues who I work side by side with. And that is how I work with them, collegially. The same way I, as an ER doctor, interacts with my cardiologist, with my surgeons, as colleagues, not as someone I have to send money to every month for permission to do my job. All APRNs must have at least a master's degree, many have a doctoral degree, must hold certification from a recognized board, must carry liability malpractice insurance, and must have more than 2,000 hours of supervised residency experience. Additionally, studies have shown those communities that permit advanced practice professionals to practice independently have better overall health outcomes. The population is better served. APRNs also happen to be 85% women, while physicians are mostly men. The last license renewal period showed that 70% of the renewing physicians in Florida were men. This should give our opponents a real gut check. Whether or not their dismissal of a large group of qualified and capable professional women is intentional, it is simply not okay. 30 other states are already benefiting from it by allowing these highly qualified professionals to do the work that they were trained and educated to do. It's time for Florida to catch up. Imagine the positive impact on patients, on access to health care, and on health care costs if we can see House Bill 607 to the finish line. Thank you.
Thank you, Representative Pigman, not only for your words, but for your leadership on this very important issue. Next up, we have the voices of Florida's great business community. Tom Feeney with the Associated Industries of Florida and Mark Wilson with the Florida Chamber of Commerce. I will turn the podium over to Tom.
Well, thank you, Nicole. And on behalf of Associated Industries of Florida, and I know a lot of other business advocates that are here today or maybe not here today, I want to first thank Speaker Oliva, who's trying to break down some of the barriers to get access to affordable, quality health care in the state of Florida. I want to thank him for his leadership on this bill. But most importantly, Dr. Pigman brings a lot of expertise and experience to this world and has been a strong advocate of making sure we can find ways to get patient care more accessible and more affordable in a quality way. You know that only 2% of Florida's physicians practice in rural areas. Access to care in rural areas is often difficult, if not impossible, to get on a timely, needed basis. So people go without care and they end up with bigger problems. But I want to focus on the business community's impacts of this bill. One estimate says that there will be over $1 billion in new wages and jobs created in the state of Florida. As Dr. Pigman suggested, a lot of those will be STEM careers for women and minorities of the future. And we are excited as we build workforce in Florida, we're excited to have opportunities open up. There are estimates, as Nicole said, that nationally the savings for allowing APRNs to do direct care under the supervision of a physician will save the economy somewhere between $1 billion and $10 billion annually. There's no better way to send the message that Florida is a thriving economy, but it's prepared and able to take care of needy patients throughout our state on an accessible basis, open job careers and opportunities, and we're thrilled to be here as part of the business community, thanking Dr. Pigman and Speaker Oliva, and I will turn it over to Mark.
I want to thank you, Tom, for that. It's great to have the business community united on such an important issue, and the Florida Chamber would also like to thank Speaker Oliva for his leadership as well. Representative Pigman, thank you for stepping forward, especially to the nurses that are here today. Thank you for making your life's work taking care of the rest of us. It matters, and this bill matters. So from the Florida Chamber's perspective, this is a simple issue, and this is the right solution. We have 22 million residents in Florida, just shy, and we're going to add 4.5 million more residents in 10 years. We care deeply about the health and safety of the citizens of Florida. We already have a shortage. This is the right solution. If we're going to have a healthier Florida and a safer Florida, we have to make smart decisions. This legislation is the right thing for Florida. We unite the business community through the Florida Chamber's Healthcare Partnership, and we've been on this issue now for a number of years. And if you look at solutions to get ready for another 4.5 million people, to give people more access to healthcare, especially in rural Florida, where we're trying to grow our economy. When you look at the fact that we're going to have another 2 million seniors living in Florida 10 years from now, this is the right solution at the right time. The Florida Chamber of Commerce stands united with all those here today, and Speaker Oliva and Representative Pigman. It's an honor to be here. Thank you.
Thank you, Tom and Mark, for your words and for your support. Thank you, everybody, for being here today. On behalf of the Floridians Unite for Healthcare Coalition, I want to thank you, and I want to thank all of those who stand here today. We have time for a couple questions.
That there's no requirement that in order to access the developing that the source so I guess I'm just curious why you think this is going to improve access to rural areas as they actually go to the rural areas.
Oh, sure.
All right, we can piggyback on each other. So what we do know is that the majority of states that have removed barriers have seen significant increases in APRNs in rural and underserved areas. So although there's no mandate in the bill as to where an individual can practice, we know that the studies show that when you remove barriers, you increase the workforce for nurse practitioners, for other APRNs in those rural and underserved areas. I can give a quick example. In Florida, there was a workforce study done 1 year after they removed their barriers, and within a 5-year period after that, there was a 52% increase in nurse practitioners in the state, and of those 52%, 73% were in rural areas. So we know that there are results, and we think that they're going to translate to Florida.
And I welcome you to come to Wauchula and visit Pioneer Medical Clinic, a clinic that's staffed by advanced practice professionals, has been there for decades. And I am a country doctor. So without mandates, several of us are already there. I don't think we'll create mandates. What we are is opening up the marketplace so more people can compete.
Any other questions? All right, thank you so much.
Thank you. Great to see you.